Yeah, definitely. So we started out as a nonprofit and working for a larger parent organization that does community investments. And with that experience, we've always wanted to look at data spatially. And when you start talking about data, there's such a wide variety of data sets to really use to understand neighborhoods, from basic stuff like demographics, but some really key things like crime data, lending information that's really out there. And you really don't realize how many different sources of data that the federal government pushes that is available. And so our goal really was to make one portal that anyone can go through from completely different industries and utilize data in a spatial way, but also start looking at other data sets that might reaffirm their understanding of neighborhoods. All right, I'll keep going. All right, so a little bit about who we are, and then I guess that I kind of explain a little bit where the data comes from. Again, our parent company is what is called a CDFI. It's a Community Development Financial Institution. Really, all it means is that CDFIs, there's only about 400 or 500, I think, total, and really about 100 large-sized CDFIs across the U.S. But CDFIs were created to fill a need that banks generally didn't fill, which is lending in areas that are much more risky, because banks have a bottom line and they need to make sure that they're making money at the same time and not lending in areas that they could lose money. So one of the many congressional acts that passed created this very unique industry called CDFIs. And so basically, CDFIs are able to obtain very specific amounts of money that the U.S. Treasury sets aside each year, and then we are able to pool that money and use that money to invest into neighborhoods that might not always attract a bank loan or even get denied usually by a bank loan. The difference is we are much more on the ground with those neighborhoods. And so with that, we've always used data to understand those neighborhoods. And we built PolicyMap because we wanted users to have that same access, and not just access to the data spatially, but access to data. So one of the really neat things about the tool is that every year since we've launched, another source of data has really come out and added more ways to look at neighborhoods and more ways to understand neighborhoods. And so the expansiveness of what we have data-wise in PolicyMap is pretty awesome, but you can really focus into a very specific set of data that you're going to be able to use to understand. And one of the biggest data sets that we work with, which is what Dr. Pruitt has worked with us for a while, is this thing called the limited supermarket access data. So we'll keep going with this one. So we built the LSA data based on the USDA's initial study of what at that time was called food deserts. And you probably heard the term, the goal of food deserts was to identify places in a neighborhood that might not have access to a grocery store. So people are generally having to travel really far from a location to find just generally groceries. And the first iteration of the food deserts was great because it started identifying neighborhoods that really had limited access. But what happened is that the idea was less about trying to identify neighborhoods, but it was more about trying to find ways to solve that problem. And so the USDA came back and we worked with them to create a couple of different studies, and they started calculating things like income and distance and urban areas and so forth. So different factors that really formed food deserts, and they converted that term to food access. So that was in line with what we did, which was more about not just finding places that had limited access to a grocery store, but actually access to a grocery store with fresh foods. And that was a really big distinction because the first initial study of food access included things like corner stores and CVS's and so forth. And those things really kind of marred the map a little bit, and neighborhoods that should really have been a food desert because they had that corner store sort of had access to food. And so we created our own study with this. And so before we go into PolicyMap, let me pull this up and I'll just give you a brief. There we go. Can you see this okay?
Yeah, it looks good.
Great.
I can see it.
So this is and I'll share this with everyone so you have access to this, but this is kind of our walkthrough of what LSAs really do and the methodology to get to why we created this. And again, the goal of the limited supermarket access was not about just identifying a food desert, but identifying access to fresh foods in that sense. So LSAs is our kind of simplified term to that. The most recent update is 2018. We're actually in the process of getting funding for a 2020 update. So that'll include a lot of really new variables. So there's some really unique statistics about LSAs. So calculating population into it, you can actually, in the first LSA was 17 million people lived in an area that we considered an equitably limited access. Some good statistics for these numbers. I won't bore you with this. You can read through it. The big distinction was types of grocery stores, and that was the big difference between our study and the USDA study, was that we wanted to look at grocery stores by type, and those types really could help distinguish between what type of services they actually might have. So conventional supermarkets are things we're familiar with. The limited assortment are still places that would have fresh foods, and then you have these specialized ones. And so the ones that really were not included were the corner stores, the club stores. And there was this gray area about dollar stores because they really wanted to enter into the market of fresh foods, and they did successfully for a few stores, but I think not all of them were integrated. So we have to always update our analysis a bit. So this is the methodology to get to what is considered an LSA. So the easiest one, of course, is identify the grocery store. And then one of the biggest changes of our methodology versus the USDA at that time was that we did a drive time distance instead of just by the crow's distance. And so we actually measured how far someone would drive from the centroid of a geography, like a block group, to the grocery store itself, and that became the actual network distance. And so with that, they based car ownership and, of course, the density of population. So the more people lived in a place that had less cars, the more needed those people that are there would have to get to a grocery store. So a lot of these references start talking about people and such. And then from there, they created a base distance, and then from that, they created the LSA scores themselves. So it's on PolicyMap. We have the stores on here. We have the combined stores. We just added the longitudinal data, which is a really big benefit. It does allow you to go back in time, and I can actually show Little Rock and how one place changed because of that change. So it's a neat study. So that's it. So we'll talk about this. This is actually a really, really cool map. It's a much better map to see live, but and really how we got to grocery leakage. And then types of stores. So I'll share this. I don't want to really dig into this, and I think it's a neat way to understand some of the different data sets that are on there. So in this case, we can go down to Little Rock. And I probably don't really want to spend much time explaining the tool to you guys. I think most of you will pick this up fairly easy. You're going to use the search bar on the very top to zoom to a place, and then from there you can add data with the categories listed here. There are two types of data that you can interact with, and they're really broken up by the columns you see here. So columns 1 and 2 are data layers, and so those are data that's aggregated or shown at a geography, so there's no address level data set associated to it. And then there are data points, which are icons in the map that shows addresses for that location, and you'll understand this when we get into the different data sets. The categories themselves are really neat, and this is really where Dr. Pruitt kind of explains that we have a lot of data that you can interact with. And again, they're based on just what you're looking at and what you're looking for. There's some really, really unique data sets. Quality of life is probably a very unique category that you would want to play around with, because besides LSAs, we have a really cool data set called the Social Vulnerability Index, and I'll show this up, and you can actually see how it ties in with LSAs a little bit as well. But otherwise, analytics is where you're going to go, and this will have all the LSA study data, which is the layers here, and then of course the grocery retail addresses used for each one of those yearly studies. So if we were to first look at car ownership, so that's one of the methodologies, right? And let's put grocery stores. You can kind of see how these two tie together. So points are the grocery stores. With the points, you can filter the type of stores. And this is the big distinction for us. Limited surface really are those stores that have a lower threshold of dollar amounts. And so that really generates, that usually resembles that it's a corner store versus an actual grocery store. You can actually see the different margins based on that. So we distinguish the two as full service, which will have fresh foods generally, and then limited service. And you can actually see those individually as well as grocery retail type. And so now we have this map that shows anything in an orange is considered a full service, and anything in this like darker blue are limited service. And you can click onto it and see what it is. So this is a city market versus the Dollar General.
Yeah, that's on 12th Street.
And so the first iteration of the methodology is to understand car ownership versus density of population. And so once you start finding these places, in this case, this is a density score of 6, which is basically for us the highest density, but the lowest percentage of car ownerships. These are where, if there's no grocery store, as you see here, they are probably in the most need, because people in this particular area would have to take a bus, get an Uber, and so forth to get to a grocery store. The grocery delivery service is really going to change our methodology in 2020. We're not really prepared for this, but we're going to start figuring out how to integrate that data into the methodology. But for now, this is based off someone going to the grocery store itself. And so you can start seeing these areas that are the highest values, which is high density, low car ownership. And then in this case, this is high density but high car ownership. So a lot of this, it's saying that most of the people that are in these darker purples own a car and they could get to these grocery stores. And you can actually start seeing how these grocery stores start populating in areas of that very specific margin, because these places would be more profitable. There's more people to be able to access those grocery stores, and then with cars to get to those grocery stores. And so this blotch of greenish here is the first threshold for that, as we consider it as a limited supermarket access. And then from there, we create a score, and the score is based on the baseline and then how far you need to move that baseline to get them out of an LSA. So in this case, all these places are at these very high above 60, meaning that the score is 60 over the baseline. And so this is how we start identifying places that are considered an LSA. And that baseline is based on distance to a grocery store, and then of course the index of car ownership and density of population.
Excuse me, Phil, could you just go over that again, just so I grasp, because that's a new concept.
Oh, sure. Yeah,
okay.
I don't really talk about this too often, but I think you guys might be able to get this. So what happens is, and it's in the slide, but basically for us to identify a grouping of places that would consider an LSA, we needed a baseline. We needed a score, and that score was based on how far distance-wise the geography is from a grocery store, and then the ownership of a car and density of population. And let me just find the other variable. But those values created a baseline for us, and that baseline created a score, and that score means that the higher you are outside of that score, you have to reduce that score to get to the 0, which is the baseline. So meaning that these places in purple are, in this case, 74 points above the baseline. And for it to become not an LSA, we need to grocery store or change the population types to get down to that 0 or the baseline. Does that make sense, everyone? All right. So the score itself is irrelevant. It's used for us to understand how neighborhoods are similar to each other. and how some neighborhoods are slightly different versus the base. So basically it's saying that anything in this white, purple is that zero, because they all are either high car ownership, low density, or really close to a grocery store. And then these ones in purple are very similar because their baseline is over X amount over that value. And so their similarity is close enough that they're grouped together then. And so from
And
that,
they also have lower access to supermarkets.
that's exactly right. Yep. And so from that baseline score is how we group together these areas. And so in the end, this is what we determine is that these places are considered an LSA. They have limited supermarket access based on the methodologies of distance to a grocery store, car ownership, density of population, and then, yep, that's it. So that's how we get to the LSA itself. And it's actually a very similar methodology that the USDA did. Again, the only major difference for them is if you were to look at their breakout, you see that they look at income in conjunction with access, and then they also understand rural or urban designation. But otherwise, they don't look at density as much, but they think about more income access in that process. So you can actually see how those two might even look alike if you overlay them.
Phil, I think you broke up. You went. The audio went away for a while.
Oh, okay.
I don't know if anyone else experienced. Did anyone else experience that?
No, he's been clear for me.
Okay.
That was okay for me.
Okay.
Okay.
Okay. So that's I mean that was the goal of the LSAs, was to identify neighborhoods that wasn't always about just access to a grocery store, but all the factors that would make them much more dependent in need of a grocery store. So we created this fantastic methodology. We published it in 2010. Nobody talked about it because what we learned is that the profit margins for grocery stores is razor thin, and it is many grocery stores run on a very, very, very tight margin, and because of that, not many grocery stores just want to build a grocery store because it'll answer a need. They need to understand that there's value in that grocery store. And so when we first published this data, we were super excited. We thought we're going to try to answer a really big problem of neighborhoods that didn't have access to grocery stores. And of course, nobody really wanted to build a grocery store. And so we came back to the methodology and we started to put dollar amounts into these areas to understand the value of actually putting a grocery store. And so the neat thing about the census is that they collected this data set called from the Consumer Expenditure Report that basically asked people in the survey how much money they spend on groceries. And so from that, we're able to make a map from the census and say that this place here, the average annual family in or the annual amount spent for this particular block group is $3.3 million in that block group alone. And then the adjacent one is $2.5 million and so forth. So there's value in this place right here. And then what we did was we matched that with the other side of that report, which is the supply, where these grocery stores, based on their actual dollar amounts, how much are they supplying dollars? And so as you can see, these grocery stores here, their supply value is 4.4 million. So that's how much they're selling because they have population around it. So those two things together you can start seeing there's like similarities and there's really differences between those neighborhoods. And that allowed us to create the leakage map, which is saying how much dollars, in this case it's percentages, but how much dollars are leaving these neighborhoods because there's no grocery stores. So the negative is not there's no negative. All the money is staying in this particular place. So it's saying $2.8 million a year is staying in this block group. But in this case, this track here is 3.3 million and 2.5 million and so forth. So this map gave a developer a better understanding of the margin that they can actually build and why they would build in there. So it's always great to champion a reason for a store to be built in someplace, but in a business setting, you need to give them value. And that's probably one of the biggest updates when we did this, redid the methodology, is to give them a value of why to build a grocery store in this place.
So that's the term retail leakage. If you could, that's where that comes from, right?
That's exactly right. So yeah,
Right.
so in this case, anything that purple is a positive.
So I think that's a really novel concept to grasp because when I first heard it, when you were talking about it in terms of understanding the money that goes out, from an economic perspective, what it means if a grocery store was present versus not in certain neighborhoods.
That's exactly right. Yep.
And so that word leakage was significant. I mean, as the action term.
Yeah, and then it's again when we started doing the updates to this methodology, we would show percentages, and they would say 100% of the money leaving here is going to another place, but that really doesn't sell the point until you start looking at the aggregated dollars, and then you're talking about millions, and that answers a much different need for a developer in that sense. So this little place right here, this Edwards Cash Saver. A neat little story, I guess, because as I was doing an update to my presentation for you, now that we have the longitudinal data, you can actually go back in time and see in 2010, whoops, let's change this. In 2010, that was all an LSA. And then in 2014, I believe, it was no longer. And the reason for that was because in 2010, this was a dollar store. And then somewhere along the way, I believe 2012 or 13, it became that cash saver. And that changed the static. So Edwards Cash Saver must have either some.
It's a full service store.
Yep.
It's a full service grocery store.
Yeah, so that's you can actually see how LSA studies now are reflects the neighborhoods that it shapes. All right, so let me take a pause. Let me know if there's any questions about the study, about the data.
I was just wondering how long it took to develop this policy map.
The tool itself?
Yes, sir.
Sure. So I don't know if any of you are doing any GIS type coursework in your studies, but you probably, if you are, then you're probably familiar with Esri or ArcGIS. And when we launched PolicyMap in 2008, 2007, we spent the year trying to find a developer that understood. Just you have to remember 2007 versus 2019, and that the iPhone had, I believe, just came out, and everybody's idea of maps was the old driving directions, really, and maybe some printed out stuff from MapQuest. Nobody really used maps the same way as we do now, and so when we were doing our R&D in 2007, trying to find a developer that made an interactive online map. There weren't that many. There was Esri, who was the founder of spatial statistics and spatial maps, but they didn't understand the web. There was Google, but they didn't understand data. They understood maps. And then there were a handful of these very small companies in the middle, and one of them happens to be the group of guys that actually end up building Apple Maps, PlaySpace, and they had built this really neat interactive technology, which is actually still what we run today. So think of this technology was actually created in 2004, was cutting edge in 2007, and it's still usable in 2019, which is another reason why we're moving off. So it took us about a year to really find a developer that understood spatial data and spatial maps, but at the same time understood tile mapping like we know today, like Google Maps and such. And there really wasn't a lot in 2007. So once we found these guys, we kind of they understood what we're trying to do. We have a large database of data, and they were able to understand how to put those two things together. The data itself, the benefit for us is that because of the work that we did at the CDFI, we had been using ArcGIS spatial mapping for, at that time, almost 25 years, maybe a little over 20 years. And so we had the data. We knew about the census. We knew about lending data and all these other variables and such. So we just needed a tool that could match that experience together.
So also, could you just speak a little bit about your data sources, just the wealth of, I mean, you mentioned the census data, mentioned data from USDA, but I mean, in terms of the wealth of information that you use to inform, I mean, that you have as your database sources for creating different GIS.
Sure. I mean, the really neat thing about the census is that we just think of the census as demographic data, but the census produces such a wide variety of other data sets, and they actually work with other federal agencies to expand their data set and put a human feel to that data. So a really neat example is in economy, you can find data for every job and wage in very specific industries across the entire U.S. So if you're looking for a job in agriculture, you're looking for a job in transportation, what BLS, which is the Bureau of Labor Statistics, does is they basically make every business answer a survey. Unfortunately, we don't have water jobs in Arkansas, I guess. But the BLS, or the county business pattern, is a division of the census. And they get every business to answer very specific questions about jobs and such. But what the census does, and amazingly, is they work with other federal agencies to join together and say, you have data about jobs, we have data about people, let's put those two together. And so they created this really cool data set called LHD, which stands for the Longitudinal Employer Household Dynamics. And you can pull this up and understand this a bit yourself. But what this did was join data related to jobs, so the type of people that have jobs, but then related to a demographic. So this is a really cool map that shows the percentage of people that are under 30. So if you ever want to find out where millennials that are working live, these are very neat maps that show that 29% of the people that are working are under 30 living in this particular census tract.
In Little Rock.
In Little Rock, yeah, in this place. And you can flip this and say, well, what's the number then? And so now you can see the number of people. So percentage and numbers are always two different ways to look at it. So any data set you add to the map will always have a source link here, as well as the title in here. So I've clicked this a few times, but this is very helpful because if you do a little bit of exploring on data and you want to learn more about it, including the LSAs, clicking onto the title will give you definitely a longer explanation of the data. And sometimes you'll get, all the time, you'll always get a link to the source, and that link will give you generally a methodology of how we got to that data. So this is LHD, and then this explains what LHD is to the data set. Yeah, some of the sources are fantastic, and it's things that you probably have heard of here and there, but it's just an amazing thing to understand. Lending is this great data set in 2008 when we launched. I don't know if you remember the housing bubble that pretty much wrecked many of the economies in the US or in the world. This data here was one of the most used data at that time to understand the foreclosure bubble that was occurring. So basically, lending data came from a source called HMDA, which stands for the Home Mortgage Disclosure Act. And basically, it's an act from, I believe it's 1975, that required every bank in the nation, when they make a loan, to report it back to the government. And the goal of that was actually to force banks not to be discriminatory about their lending. So that way they're not just lending in areas that are rich, they are they're diversifying their loans. So HMDA was an amazing data set because it was a rich data set that went all the way back to 2004. And so if you were to look at the housing bubble for subprime lending and lendings for HFAs and such, you can see where it started dropping off the cliff for that data. And this was one of the biggest data sets used at that time to understand the impact of future places. You can start forecasting what neighborhoods coming up based on the trending of foreclosures and the trending of another data set called cost burdens. You can put those two together and start really identifying neighborhoods that have the biggest risk for foreclosure. And then from there, a lot of CDFIs actually created initiatives to go in and try to help those homeowners at that time to get out of their underwater mortgages, or at least save their areas. So this, another one of these many data sets that you probably might not have heard of HMDA, but it is just an amazing data set if you're in the lending world. Another data set is home sale data. So this is from Zillow. Zillow actually records every home sale transaction in the US, just like the home sale tool that realtors use. And the difference was that Zillow wanted to be able to take that data because they only had it at the address level, and they probably had a data team that could aggregate that data and show it at geographies like zip codes and so forth, but they didn't have the methodology that we had created a long time ago when we created PolicyMap. And so they basically gave us the data, gave us the ability to apply our methodology and do these really neat aggregations with their home sale data. So this is a really neat partnership that allowed us to get access to home sale data, but then from there, create a methodology of data for Zillow to use in their own research. Probably the biggest growing data set that you will hopefully want to look at is the health data. Health is such a unique category that has really affected neighborhoods. When we first launched PolicyMap, there's only a handful of categories of data related to health, and it's really from the CDC. And that data from the CDC, because they are very good about protecting privacy rules, they only show data at these really large geographies, metro level, state level, and such. But as health became a really important indicator to understand neighborhoods, especially in case of food access, because then you can start talking about obesity, exercise, and so forth, other agencies started producing smaller area estimates. And so with that, you're able to look at a neighborhood and see, this is a really bad map for you guys, as well as Philadelphia, but this is basically saying this particular tract, 35% of the adults are considered obese based on the BMI rate. Now, again, percentages and count are always two different things. So while it is 35%, it represents 539 people of the overall population in that tract. Yeah, so I mean, I wanted to give you some ideas of different data sets. The only other one that I wanted to talk about was some of the index data sets that we create. If you are familiar with the census, and hopefully you're able to use some of these data sets as you understand neighborhoods and such. If you use the census, when they talk about race, they mainly want you to understand one race at a time, looking at areas that are mainly white, areas that are mainly Black, Asian, Native American, and so forth. And while that's always helpful, this gives you this map that you might understand neighborhoods. So this is saying these areas in white have less than 52% are white. And what we wanted to do is put those things together, because the census really doesn't want you to look at it sometimes the same. And this gave a really cool map. And so it's very similar to the map that we just saw, but the difference here is that you can start seeing, in this case, anything in green are places that are predominantly Black, and anything in blue are places that are predominantly white. And then the in-between colors are the ones that really represents kind of a meshing of the neighborhood itself. So in this case, this place, while white is the predominant race, it isn't the majority. It actually is, so it's very mixed in its area. So that's one of the really neat index data sets, and the other one that I wanted to show you is the social vulnerability index. Same idea here. Instead of just showing you income or housing costs or access to a grocery store, a really neat researcher created an index based on a methodology of data, and then with that, they're able to create areas that are considered at risk or high risk. So these places here, based on housing, transportation, and again, if you want to learn more about any methodology, click onto the title, and this will break out the entire methodology or the research for this one. So this talks about home ownerships in large multifamily buildings, mobile homes, crowding, and then access to a car. So this is car ownership as well. So hence the housing and transportation social vulnerability index. And so this is saying these places here are high risk based on those two very specific factors.
So Phil, could you talk about under the limited food access, some of the work with the dollar stores as as sources of food in communities, and your work that you started, that PolicyMap started with that?
Yeah, so I'll put the leakage back on so you kind of see a little bit, and then what we can do is we can actually now filter by dollar store. So as Dr. Pruitt mentioned, one of the things with dollar stores was they started venturing into the world of having fresh foods in them, and I think there were some that started doing it, but the problem again with dollar stores in particular was that they had a high volume of sales, even though it was a dollar store. They did actually represent high volume of sales, but unfortunately, most of those sales weren't fresh foods. A lot of times it's cereal, it's high carbs, high things that can stay on the shelf much longer for that time. So it was a very big challenge to understand which dollar stores were making the transition, and they didn't fully publish all their stores, and so we unfortunately we use them as a buffer sometimes. So you start kind of seeing this trend here, and if I were to actually take away leakage, you can start seeing the relationships as they sort of answered the need for access to foods, but they really it wasn't enough to reflect their full impact of an LSA. So in this case, even though there's no dollar stores at all in here, some of them probably did have fresh foods in those access. Yeah, unfortunately with dollar stores, Elaine, is that we're still trying to get a more clear data set from the industry itself, just to figure out which ones that we could apply.
Yeah.
Yeah, I think you probably had a little more experience understanding which, in particular in Little Rock, which ones were trying their approach for fresh foods in their locations.
It's very rare.
Yeah.
Fresh. Yeah.
This is Andrea. I know there was an effort to do like a local count, like to actually like have like to get like collect local data to kind of go to the different stores, involve the community, and actually invest in determining what they keep at those stores. But yeah, I would understand it would be a difficulty to try and see what the issues would be between like what the industry is going to provide and what you can find locally.
Yeah, they have a hybrid that they started back in 2012 called Dollar General Market, and that was their selling point. They were a small version of Walmart, the neighborhood market, so they sold fresh produce. And so that started back in like 2012. Well, I went, it happened to be somewhere and, couldn't pass up the opportunity to go in the store. So they literally were a small Walmart, food neighborhood market, but they're very limited in terms of where they are and actually selling produce, but they're called Dollar General Market.
Yeah, and our problem was that they didn't distinguish that type of store in their data. So at that time when we were buying grocery retail locations, it was a company called Trade Dimensions, and they actually got bought out by Nielsen. So if you ever heard of the Nielsen ratings for televisions, it's the same company. They are just buying things up. And so Nielsen bought store locations, and actually they bought business locations across the US. And so when Nielsen bought Trade Dimensions, they did actually try to force some of these more specific questions for stores to answer. We just that survey hasn't caught up to the current data, so we believe 2020 will have hopefully a better distinguish for Dollar Generals, Family Dollar stores, and if there's a market to that store itself. Because right now it's still considered limited, and conventional is what they need to get to based on dollar amount. So in this case was so this was the Food Saver from 2014, but it is now a so sorry about that. Let me do this one more time. Yeah, so he's now it's in the same location. But yeah, so we definitely know that Nielsen is adding a very specific question in their survey. So 2020 is going to be a really interesting update for us. It is the having to apply food delivery services. A lot of grocery stores now offer that, and it really does change a little bit. Some stores do it for free. Some stores have a very minimum charge. Some stores have a minimum purchase. And so that'll change the dynamic quite a bit for the research. LSAs might just be smaller in need, but the dollar spending amounts will still be high. So even though many people in these places might be able to use delivery services, this is some of the understanding of our methodology, their need is still going to be high. So they're still going to have to order from a grocery store that's outside of their area, and that still has to be delivered. So more people start moving into denser places, it creates a larger amount of need still, and without a grocery store directly there, then it's still considered a grocery retail, a limited access area.
And by and large, the retailers are not taking EBT cards for grocery delivery. So if you're on SNAP, you can't use your card to, by and large, that's not the norm yet.
I thought that was being like rolled out, like in certain areas that was being tested out, that they were going to start doing it.
It's being tested. It's just there's been a lot of resistance, I understand. I'm hearing.
Yeah, it's probably nationally not done yet. So you can actually look at SNAP retail locations as well. One of the data sets. So, but if you look at some of these points, what you're going to see is this is probably a corner store, the Roadrunner 15. So it's a food market. So in this case, this probably has fresh foods, but the threshold for a conventional retail store is a dollar amount. So they might have a good mixture of actual fresh foods, but the difference is it might be a really small shop, and so for them, they probably aren't answering the need of the neighborhood all the way around it, but maybe just that very small block that it sits in. So there's a lot of really small factors that we have to apply to really understand what an LSA would be, because how it affects the entire neighborhood. So really small corner stores, while they do help the need for this particular block, the overall effect for the tract or the area that it's in probably isn't as beneficial. So before I jump off too far, do you understand what block groups and tracts are? Do you know what those geographies represent? Maybe. Okay.
Yeah, I do.
Okay.
I do, since because I'm a GIS person, so this is the benefit I have.
Perfect. In case
Yes.
no one doesn't. I'll give you a really simple explanation, so that way you kind of understand there's a context to them and what they really represent. So this little boundary here is what is called a block group. So basically what it means is the census that we do every 10 years, and now every year with the American Community Survey, when the census publishes data, they don't publish individual information. They have to group people together into geographies. And the smallest geography we use from the census on our mapping tool is this thing called a block group. And a block group represents about 400 to 1,500 people, and it's really density of population. So some of these block groups are very small as we stay within these urban areas, but if we were to go out to the other side of the highway, you can see how large these block groups are. So there's less people living there, and that's the density of population. And that's really from there, it builds up. So a grouping of block groups form a census tract, which is about 1,500 to 5,000 people. And then tracts form things like county subdivisions, which are sometimes neighborhoods, and then so forth. So just to give you an understanding of size and what a block group kind of represents. So you can think of it as about 1,000 people is the average, but just density of population. And so that really, if you tie that to leakage and you're talking about dollar amounts, it's basically saying that about 1,500 people live in this highly densely populated block group, and they're spending 3.3 as an average $1 million a year for food expenses.
And there's not a full service food store in relatively close proximity.
There's none. That's right.
Okay.
Yeah. So everything, there's just these dollar stores and the Cash Saver, which does answer that need for this particular area, but because it's so dense. The other thing, when you think about drive time, we apply things like highways and bridges. And so, if you are walking distance, it's probably really tough to get through this highway or actually across the bridge. So drive time measurement really changed the methodology of how far someplace really is to a grocery store, because if you apply major highways and such, then it causes larger disconnect, railroads and so forth. All right, any questions about what you've seen, about the data in the tool? Okay, I mean,
you'll be using data from. Oh, go on. Someone.
Yeah, well, I'm personally excited because this is kind of like the work I'm heading into myself. I do GIS. I have a background in GIS. I spent 7 years as a cartographer and GIS analyst. But also then, I'm doing more and more analyst work, and then I just got an offer to work for the CDC. So I'm kind of excited about the potential to be able to work with this data set work. I was curious though, with are there particular things you're excited about with the new census data that's coming in 2020? Because I know a lot of this data we have is previously from 2010. Are there things you're excited about being able to do through PolicyMap that you couldn't, that you want to be able to do with the new 2020 with the new 2020 data when it comes out?
Sure. So the really neat thing about the census was that after 2010, there's always been a constant uproar about the census because it's every 10 years, and so realistically, after 3 years, the data is really stale, and there were always these companies that came in and had methodologies to do projections to current year and so forth, and it was just something that the census really had to answer. And so their answer was the American Community Survey. So the ACS basically is the old long form of the census. I don't know, you guys probably aren't familiar with the census, the old census, but they used to send these ridiculous books of about like 600 questions. And and of course, everybody gets a book of like hundreds of questions. No one's really going to answer it. And that's the reason why the census now is 11 questions. It's basically age, income, sex, and so forth. So the decennial census is very short, but the ACS happens every year. And so with the ACS, it updates numbers that we would have to wait every 10 years. And the ACS, because it's done every year, they get to add new questions to their really change or get more information as it's needed at the current time. So one of the big questions that were added probably 5 years ago was, do you have health insurance? And that was a really big factor for the ACA to be able to understand coverage and understand the actual impact of not having health insurance in given neighborhoods. And because it's from the census, they were able to break out very specifically things like age. And so now you're looking at health insurance for students under 25, and why that 26 catch rate to your parents' insurance was so important, or things like income. It's how much money do you make that don't have health insurance. So the census, the ACS in particular, is such a neat census because it adds very relevant questions to the survey each year based on needs in what it's trying to answer. So we're excited for the 2020 census. We're actually more excited for the boundaries. We get really nerdy because these tracks that we talk about, these block groups and tracks, get redrawn every 10 years though, because population shift from place to place. So we're more excited about boundaries. The data itself will be excited because it's much more accurate than the estimates of the ACS, but it won't be, you can actually start verifying some of the current census data sets.
So I think you had mentioned, I think you had mentioned last year in your last presentation about, I guess redraw. Well, that's maybe I'm answering the question, but you talked about the redrawing of the boundaries and those being able to look at that in terms of voting participation and redistricting and gerrymandering, those kinds of things.
Yeah, so this is really where this fantastic data set of predominant race comes in, because what a lot of some of the government agencies do is they use this actual data that you see here, and they can basically look at how they would carve a neighborhood up for gerrymandering. So if I were to put congressional districts on this map, whoops, you can probably, let's see if it cuts Little Rock up a little bit. All right, so you guys aren't as bad at all. So in this case, you are pretty fair in your boundary cuts, see, as it's carved here and there. If you want to see really what it does, let's go to one of the craziest maps you can find. And in Chicago, what you have here is this fantastic grouping of neighborhoods that are mainly Hispanic, and then of course white and African American. So this is a congressional district, which is actually purposely condensing these two neighborhoods of Hispanic or populations into one, and the connecting line, if I were to zoom in, is a highway. So they literally cut this all the way back to here. This highway is the only reason why these two places are connected together. So this is it's an amazing map sometimes that shows how gerrymandering could work. And if I were to go to Philadelphia, so this is the world of maps that you get to see sometimes. Sometimes it's good and bad. So this is the new boundaries that we have in Philadelphia. We fought pretty hard to make sure that it was fair, and you can see how it just kind of splits the city up, and even the localized, more rural congressional districts are pretty fair. But if we were to look at the boundaries that were originally used, you can see how it actually wrapped itself in. So this particular congressional boundary purposely cut into areas that are predominantly white, and then cut out areas that are slightly Black or Hispanic. And same thing down here. This congressional district carved itself into mainly Hispanic or Black populations in Hispanic. So gerrymandering is definitely a problem for a lot of companies, but the good news is that there's plenty of data to help fight that a bit. And then just a very last thing, and we're going really far. If you ever want to use this data somewhere else in PolicyMap, you can download it. So for, I believe, Austin, you can actually download any of the data that's in PolicyMap, and what you're going to get is a file that has the FIPS code for the geography. And so that way you can just recreate these layers in ArcGIS because you can join it to a boundary file. But for anybody else, if you wanted to download all of the dollar amounts in Little Rock or in the state of Arkansas, you can actually download all that into one complete file and then do a much larger analysis of what you're trying to research of a given area. So instead of just looking at things visually, you can have data that you can create to support that. As well as the maps themselves, you can export you can export out of the tool and giving you a chance to use these maps in your presentation or your work and such. And the maps themselves are pretty simple. You can pan the map within here. You can export it when it comes out.
This is Austin. I had a question. Did I hear you say earlier that you publish your own studies based on different data that you have?
Yeah, we don't publish. We do publish some data work, but what we do is we create data based on the public sources. So in this case, this predominant race is one of these indexes that we created. Disaster risk was another index that we found that was online, and then we used their methodology to create the layers to support it. We do have some published work, and I will share the LSA data and their published work so that we can see some of their reports that they have for it, because that's a different team that does that very specific research. They actually do a really cool analysis also called market value analysis, which is this amazing study that that talked about neighborhoods and the different changes. So this was actually a really neat data set that we created to help cities understand where neighborhoods are trending, where neighborhoods are declining, but also where neighborhoods are stable. So we do create these methodologies based on overall data sets together.
Mr. Vu, I had a question. Do organizations right now in Arkansas have access, like licensed access to look at your data?
They do not. The tool itself, there's a public-facing function of this, so most of the data that you're seeing here is actually accessible for anyone to just use it. We do work with some agencies across the U.S. In particular, I don't believe we have any government agencies in Arkansas that are using it directly for it. So yeah, unfortunately I don't know off the top of my head who it would be.
Okay, but the data you've shown, that actually is publicly available.
Yeah, the problem is you can go to the census data, you can go to the census today, but what you're going to get from the census is not a helpful map that understands the differences across the neighborhoods. You're just going to get the numbers of those places itself. So you actually have a visual aspect of the census. And that's really one of the that's where Austin's going in his experience with cartography and GIS is you're taking that data.
It's Andrea.
Oh, I'm sorry, Andrea. I apologize. But yeah, she's taking that data and basically putting it onto a map like this. And what we wanted to do when we created PolicyMap 2, it was to jumpstart that for the average user. So yeah, I would say most agencies, state, even local government, are using data like this, and they probably even have a GIS person that are producing these maps. The difference is that the maps that they produce is sometimes only accessed by a handful of people, and it's not really collaborative. They can't just give it to somebody that works in the police department and somebody that works in the mortgage department and the license department and put those two things together for them to interact with.
Yes, that makes sense. Well, this data is very powerful.
Yeah, the state itself has its own spatial data infrastructure. They have the Arkansas the GIO, the office.
Yep.
So you can go there and access a lot of data sets from there. And they're also one great thing about it is like most data people, most in these agencies are really helpful in trying to get people the data that they need. And Arkansas does have a unlike some other states, they do try to. The state is really good about free access to that to data. So I mean, it's one of those things. If you don't see it available, you can always ask the folks over at AGIO or other places that do data work here in the state.
Yeah, data people love talking about data, so always ask them. So the great thing is, what we'll do is
here's the great thing that I'm not going to put pressure on Phil, but here comes the surprise.
So there's usually a subscription to this, and for Dr. Pruitt's class, we usually give all the students a couple of months subscription. So you'll be able to jump in, download data, make the maps, and because we have a different level, we actually will get you into that premium, so that way you can start downloading some of the health data sets as well. But unfortunately, I won't set you up tonight. It'll probably set you up tomorrow, but you'll all have an email login tomorrow for the tool. That's good for a few months.
Thank you again so much. I didn't mean to pressure you, Phil, but
no problem.
It kind of was, right? But, nothing like asking in front of everybody, right? So,
as they say, if you don't ask, the answer will always be no.
There you go. There you go. There you go. There you go. Well, again, thank you so much for this. And I learn something every year, of course, and just we'll be logging in on the new data set once we get our login to look at some other things going on in the city and in the state in general.
Yeah, hopefully next year we'll have an update to the LSA that it applies dollars that are being used for delivery services. So
yes,
we'll see.
Yes, definitely. Well, again, thank you so much for this. As always, it's been excellent and very informative for me, and keeps me committed to what I think is important.
Great.
So everyone, we will join. If we'll come back, I think it's about 6:43 our time, 6:43. If we'll come back maybe at about 6:50. Is that 7 minutes? Yes, about 6:50, 6:55 or so. And we'll join by Blackboard Collaborate and continue our discussion and review the case studies for the evening.
Okay, sounds good. Thank
All
you
right.
so much.
Thanks, everyone. Thanks, Phil.
Thanks, everyone. Have a good night.
Thank you.
Bye-bye.
Bye.
Thank you.